Good morning, everyone. Thank you all so much for joining us. We're going to get started in just one more minute so we can have everybody get a chance to hop on. All right. Good morning, everybody. Welcome. I'm going to go ahead and share my screen really quickly. Thank you so much, all of you, for joining us today. We're very excited to have everyone here. Excuse me. I apologize for my slight lack of voice. So hopefully we can get through that. And here we go. So hello. My name is Rose Spickler. I am the Director of Statewide Engagement for Michigan Sustainable Business Forum. I'm very pleased to welcome you to today's presentation of Michigan Sustainable Business Forum's webinar series in partnership with Michigan Clinicians for Climate Action, which you will hear more about shortly. For those of you who are not familiar with Michigan Sustainable Business Forum, the forum is a collaboration of businesses and institutions dedicated to promoting practices that advance climate leadership, social justice, and the creation of a circular economy. We host events and programs throughout the state, including this monthly Michigan Sustainable Business Forum webinar series. This webinar series is, sorry, one moment, I'm so sorry. There we go. All right. This webinar series is sponsored by Shupan with additional support from Foresight Management. We hope that you'll join us later in the month for another webinar in our series, How the Anti-CRT Movement is Impacting DEI Initiatives. We're going to discuss how the politicization of diversity, equity, and inclusion is impacting the workplace, government, and especially public and private education across the nation. We are going to introduce recent research from Western Michigan University on political weaponization of DEI. More details can be found at misbf.org, which I'll put in the chat shortly. I'd also like to take a moment to discuss our current work with another partner that both Micah and ourselves work with, the Climate Action Campaign. We're encouraging our membership and interested parties to learn more about their Solutions for Pollution campaign and about the EPA's proposed standards to cut climate pollution. In May of this year, the U.S. Environmental Protection Agency proposed a plan to cut climate pollution from existing coal, existing gas, and new gas power plants. Fossil fuel plants are a top source of carbon pollution driving climate change. And Michigan utilities are taking steps to decarbonize by 2030 to meet these regulations. They've also announced sustainability goals to be aligned with the EPA's reduced carbon plan. These strong climate pollution standards for power plants, along with other solutions for pollutions, will help put the U.S. on track to meet the president's promise to cut climate pollution in half by 2030, as well as benefit our health, the climate, and communities nationwide. For more information about this and to support these changes, I'm going to be putting a link in the chat as well. We also have been working alongside the Climate Action Campaign, as I know you'll hear later in this webinar, on the Inflation Reduction Act, signed by President Biden in late 2022, which encourages the United States to remain the global leader in clean energy technology, manufacturing, and innovation, and most of all in health. Please do consider becoming a member of the forum if you're already a corporate or institutional member or one of our regional programs. A professional membership to MISBF is complimentary. If not, you can become a professional member today for only $50. Now I'd like to introduce our program for today, Climate Smart Healthcare. For our attendees, please note that you can share thoughts and questions with the panelists or with all attendees through the chat function. We'll have time at the end of the presentation for open question and answers. I'd like to start by welcoming our facilitator for today, Sarah Chartier. Sarah is a passionate conduit of system change with a decade of experience in corporate sustainability. She's an experienced program manager within the healthcare industry, successfully integrating sustainability and supplier diversity into operational and support services, including supply chain, facilities, and food services. Sarah recently launched her business, Ube Consulting, and currently is working as an impact purchasing consultant with the Healthcare Anchor Network. She has her MBA in project management certification, and she's a TEDx speaker, an experienced nonprofit board member with MISBF, as well as other boards, and was named notable leader in sustainability by Crain's Detroit Business in 2022. So thank you, Sarah, so much for facilitating for us today. And I'll let you take it away from here.
Thank you, Rose, and good morning, everyone. So pleased to be here with you and excited to see the continued work that the forum's doing to address climate change. I'm happy to be here today as a volunteer with Micah, and I will be leading us through the conversation. Before we get started, if you haven't had the opportunity yet, we'd ask that you take a minute to introduce yourself via the chat and let us know which organization you are identifying with, or if you're here on your own. And as was mentioned, we'll collect those questions and we have time at the end for the conversation. So I want to first start by setting the stage as to why we're here today. Some of you may remember that the IPCC recently came out indicating that urgency and how critical it is for us to address climate change now. Specifically, when we look at the healthcare sector, though we have a healing mission as a healthcare sector, we are responsible for 8.5% of the greenhouse gas emissions. And according to a recent Lancet report, globally, it's 5.2 emissions in 2019, which is an increase. Without action, healthcare emissions will continue to triple by 2050. And the IPCC said in order for us to meet this challenge, it will require government, international community, and strong alignment with the public sector of finance and policy. So how can we address this? The US health, as a health sector, also has a large financial impact with 18% of the GDP here in the country, and the highest healthcare emissions per capita in the world, with 27% of global healthcare emissions or global healthcare climate footprint. Coupled with all of that, we know that as a institution, hospitals and health systems aim to address the health of the community. For about 40% of overall health of an individual happens through social determinants of health, which are outside of in the type of care you receive within the hospital. So to address climate change, we must also, within the framework of healthcare, we must also address issues of individual health and exploring climate resiliency as an avenue to support that. So want to make sure that our conversation weaves in some of these sticky problems of climate, racial and financial inequity that exists within our communities today. So with that, I would like to introduce our panelists. We're going to do so with some questions. So Dr. Collins, you are a gynecological oncologist and current chief medical officer with the county care within Cook Health Hospital System, and recently completed the Climate Health Equity Fellowship with the Medical Society Consortium on Climate and Health. Would you tell me a bit about how you became interested in integrating climate change into your clinical practice, and why health equity is important in addressing climate change?
Good morning. So as a Black woman, I was born on the south side of Chicago. If anyone knows about the south side of Chicago, that's where a lot of our steel mills are. So when we look at that area, as I knew that I wanted to do medicine, began to look at that intersection. 38% of that population lives in poverty. It's a primarily Black community. 21% of the population is unemployed. We have 40% of our population with high blood pressure, 31% of our population with obesity, 11% of our population with diabetes and asthma. And then I saw the association with cancer. As I dug a little deeper and looked at how I could make a difference in terms of changing that trajectory, I then saw the intersection clearly of how the environment plays a role in a lot of those conditions, and unconnected then became connected clearly to climate change, and began to look at ways that I could educate my community in terms of how they could make a difference in their lives. And then the fellowship came, and was happy to be in that second year class, really with the goal of educating the community on the intersection of climate and health, but also educating my colleagues on that intersection because there's still a lot of knowledge to be gained. And really want this group to understand that you cannot disconnect climate change from healthcare disparities, from equity. Climate change becomes a multiplier of all of those social risk factors that we talked about. So that's why my interest is and continues to grow every day around climate change.
Thank you, Dr. Collins. Important and valuable perspective that you're offering for us today. Dr. Del Bueno, you are the current president and founder of the Michigan Clinicians for Climate Action. Would you please tell me a little bit about MICA and how you got interested in the concept of climate smart healthcare? Oh, you're on mute.
Unmuted.
Yeah, I just realized, sorry about that. Thank you so much, Sarah. And thank you also, Yvonne, for Dr. Collins, for your perspective as well. So Michigan Clinicians for Climate Action, who are we? Well, we're a coalition of Michigan health professionals that are really starting a movement that includes health professionals of all types and all stages of their careers to lead the way within the state to a healthy climate for all Michigan residents. And we will do that through advocacy and education at the intersection of climate, health, and as Dr. Collins pointed out, equity being so important. We are one of 22 state affiliates to the Medical Society Consortium on Climate and Health. And that is a consortium of 49 medical societies, including the AMA, representing over 700,000 practicing clinicians. That's kind of the grass top aspect of the movement, where the state affiliates act as the grassroots efforts. And if you talk to the leadership within the consortium, they'll tell you that it's this grassroots state affiliates that are much more nimble to take action and really get a lot more done. So how do we become interested in climate smart healthcare? Well, healing is central to our mission as healthcare providers. We take an oath to first do no harm. So it's critical that we clean up our own home first, if you will, the healthcare sector. We envision engaging with health professionals across the state, helping them lead in their healthcare systems and in their surrounding communities, helping them understand why it's important to reduce emissions through decarbonizing or electrifying, improve the resilience of healthcare facilities, because we know that extreme weather events will become more common as the climate crisis unfolds, and to understand our role as advocates for our patients' health and for the communities as we intersect with the climate crisis as a whole, keeping in mind that those on the front lines of fossil fuel pollution have borne the brunt of our current energy system with their health for decades. Most importantly, though, I hope this work will serve to educate health professionals how we can advocate around the fact that climate solutions are health solutions. Much of what we do to address the climate crisis is good both for our personal health and our public health. And that's true when we think about reducing emissions within our healthcare sector. And it's also important because we need to have the long view, as Dr. Collins mentioned. We can't just treat symptoms in our clinic and have the patients show up time and time again with the same problem, sometimes progressing over time. We have to look at the root causes, the systemic causes of illnesses, recognizing that environmental pollution and cumulative impacts disproportionately affect low-income communities. We need nutritious food, clean air, and clean water. So most importantly, though, I hope that we can empower health professionals to clearly envision that healthy world that truly is ours to claim. We can do this thing, and we are doing this thing, and health professionals are uniquely situated to lead the effort. But we'll discuss that more in subsequent questions. Thank you.
Wow, really powerful. Thank you so much. And I think you're bringing up a great point to Dr. Del Bueno, in that clinicians are trusted members of the community. And when you share something is important or impactful to health, typically folks will listen. So appreciate the both of you and providing the perspective that it's not just a doctor's visit, that we need to take responsibility for the health of our full community. And so looking at this from a different perspective on the operational aspect of climate change and healthcare, I want to invite Kaylee Swanson into the conversation, and she's a sustainability analyst, new to her role in January at Corewell Health. So Kaylee, has your role always included greenhouse gas emissions, and what similarities and differences between sustainability and climate smart healthcare do you see in this conversation?
All right, hello everyone. I'm Kaylee Swanson, and first of all, I just want to thank everyone for having me here today. As a sustainability analyst at Corewell Health, I sit within the supply chain department and work with supply chain and other departments and subject matter experts on a handful of sustainability goals. So including transitioning our fleet from internal combustion engine vehicles to alternative fuel, greening our ORs and moving away from disposables and more towards reusables in different product categories, reducing waste, anesthesia gas, and increasing the amount of sustainable food options we offer. So Sarah, your question, you can probably speak to better than I can, as I just started in January. So I can't speak to exactly how greenhouse gas emissions were taken into account historically. However, I do know that Legacy Spectrum Health has had a sustainability program for nearly 15 years now. So would think that the sustainability initiatives that have taken place over that time period have reduced our greenhouse gas emissions immensely in some way. So that doesn't mean our greenhouse gas emissions might not have grown over time, though. We have merged with many hospitals and many health systems since then in that 15-year time period. But we do have a goal to be carbon neutral by 2040, which we are actively working towards as we speak. And as for the differences between sustainability and climate smart healthcare, so sustainability I think of as a framework used to determine how we can meet the needs of today without compromising the needs of our future generations. So there are really three pillars of sustainability. We have people, planet, and profit. So if something is truly sustainable, it should check all three boxes. So this framework can be applied to any industry. It can be applied to any industry, big or small. And it can also be applied on the individual level. So you can apply it to your own life too. Whereas climate smart healthcare addresses the negative effects climate change has on our health and focuses attention on how the healthcare sector can really own this and do their part in combating climate change through decarbonization, resiliency, and advocacy.
Thank you, Kaylee, for that. Very exciting to hear Corewell Health has made that commitment, and look forward to learning more about your journey along the way. So now we're going to transition a little bit deeper into some questions around climate change as a health emergency and ways that we can urgently work to reduce greenhouse gas emissions to alleviate the worst health impacts of the climate crisis. The American Medical Association has called climate change a public health crisis. In November of 2021, over 200 medical journals stated that the average global temperature rises above 1.5 degrees Celsius, it would be catastrophic to human health. And we are currently at an average global temperature increase at about 1.1 degrees Celsius right now. So we know this is an urgent problem, and we have a growing movement of clinicians who are eager to jump on board to engage this. So Lisa, what needs to be done in order to achieve the goal of staying under 1.5 degrees Celsius, and in what time frame? And specifically, in particular in the US, because we know we're responsible for 8.5% of US greenhouse gas emissions. What has the healthcare done to date? And can you introduce us to this term a little bit more of climate smart healthcare?
Sure. Thank you so much, Sarah. So as you mentioned, editors from over 200 medical journals gave that really dire warning, and that's their terms, not ours, that if we get above 1.5 degrees, it would be catastrophic to human health. Climate experts tell us that in order to achieve that goal, we need to reduce emissions in half by 2030. And that does sound like a tall order, but there's some good news. And that is that Congress passed some really meaningful legislation last year that has the potential to reduce emissions in aggregate 40% below 2005 levels if fully implemented. So we need to achieve 50% below 2005 levels. So this is a great step in the right direction, but we still need a full court press in order to achieve the full benefits of the legislation that's passed and to pass additional legislation that gets us to where we need to go. Now, health professionals can lead toward solutions that will improve human health and the health of the climate in these efforts. And since much of what we do to address climate change is good for our health, we need to emphasize that these measures will save lives and it'll save healthcare dollars and it will increase productivity at work and school. Now, you asked, what has the healthcare sector done to reduce its emissions, which it's outsized, 8.5% of greenhouse emissions in the US. And fortunately, the US was one of 50 countries to commit to decarbonizing the healthcare sector at the COP26 that was in Glasgow in 2021. And in response, President Biden has pushed out a voluntary climate pledge that Riley will put the link of in the chat as we speak, so you can take a look at it when you want to. Institutions that take that voluntary pledge commit to instituting measures that would improve climate resilience and reducing emissions in half by 2030 and achieving net zero by 2050. Now that is tough, but we know that 116 organizations, including 872 hospitals as of April of 2023, so that number has increased, have already taken the pledge. Additional stakeholders include suppliers and insurance companies and group purchasing organizations and pharmaceutical companies. Federal systems like the Indian Health System, the Veterans Health Administration, and the Military Health System are working together as well to meet similar goals as those we've just described in the private sector. And combined, it's over 1,000 federal and private sector hospitals that have taken such commitments, and it represents about 15% of US hospitals. So we are starting to make this transition, and we need each of you on board here in Michigan to push out climate smart healthcare. And I think, Kaylee really, nailed what is climate smart healthcare. I always refer to Healthcare Without Harm, who has worked in this space and practiced green health for decades now. And they define climate smart healthcare with 3 pillars. Mitigation, so that's a hospital's tendency to reduce their own carbon footprint. Resilience, which is preparing the health facilities for climate impacts, and also building community resilience, so that when there is a power outage, as we see all the time around here, we're ready to handle that, or if there's flooding. And then leadership. We want to mobilize the sector's ethical, economic, and political influence to advance climate smart health policies. And this is where Micah is really focused. We're committed to all 3 pillars, but importantly, we want to empower those health professionals to lead. Thanks.
Thank you. That was a lot of really good information and a lot for folks to think about how they can take action. And speaking of flooding, I did want to call attention to a 2019 study that from the National Academics of Science, Engineering, and Medicine that found racial and ethnic minorities in Houston, Chicago, and Baltimore are disproportionately affected by flooding. So when we talk about the intersectionality of addressing climate change, it's important to acknowledge the historic under-resourcing that has occurred in communities of color to address to solve and address for that problem as well. So wanted to dive a little bit further into this with you, Dr. Collins. And we know that it's possible to address pollution and climate change at the same time. So could you speak to how pollution impacts the risk of developing cancer and other chronic diseases? I know you touched on this briefly, but if you could dive in further. And if hospitals were able to decarbonize and align with the climate pledge, how would that impact communities living closest to the largest hospital systems and the most vulnerable?
Absolutely. So air pollution and climate change go hand in hand. We can't talk about one without talking about the other. We know that when we look at all of the data, 7 million premature deaths, 7 million are due to the impact of air pollution on health. When we look at sort of that realm of how air pollution poorly affects health, it goes head to toe. So you have increased headaches, increased anxiety, increased irritation of your eyes, your ears, your nose, your throat. We've seen increased cases of asthma exacerbations and COPD, increased risk of cardiovascular disease, that is not only stroke and myocardial infarction, but hypertension. We've seen effects on the liver and the spleen and the blood, that is increased risk of liver fibrosis, metabolic disease, in addition to liver cancers. We've seen an increase in lung cancer, the #1 cancer in terms of mortality. When we look at it, there are direct correlates with the pollutants in the air and that cancer. We've seen a direct correlation also with fertility. As we talk about the astronomical numbers of minorities that are dying related to maternal and infant mortality, we know that there's a direct correlate of air pollution and reproductive health. So low birth weight babies, increased hypertension in moms who are pregnant, increased infant mortality. We see increased congenital heart diseases, all related to air pollution. If you can't look at it from the health aspect in terms of 7 premature deaths, we also have to look at it from an economic perspective. As the CMO of County Care, which is the largest Medicaid health plan in Chicago, we spent $49 million last year on asthma and COPD. So not only is it a health aspect, which we have to continue to focus on, but if you look at your bottom line, you will change your bottom line in terms of spend if you take care of these diseases. So if we decarbonize, we're going to reverse it all. We're going to see decreased asthma exacerbations. We're going to see decreased COPD. We're going to see decreased ED visits and hospitalizations related to those diseases. We're going to see a decrease in absenteeism. Again, when we talk about equity, that's a population. Again, we already see absenteeism for other reasons. To increase and layer on top of that, absenteeism related to asthma attacks is something we can eliminate. And we're going to increase the life expectancy of our population. So controlling the pollution in our air, which we all have a responsibility for, will also change the trajectory of our health. And hospitals play a big part in that.
Really powerful. Thank you for sharing those disparities and the opportunity to address that. I like to think of healthy people, healthy planet, and vice versa, right? If we have a healthy planet and we are good stewards of our environment, then we're good stewards in supporting our larger community. And thinking about this as something that's outside the 4 walls of a hospital is really important. So appreciate you offering that perspective as well. And we know that sustainability and climate smart healthcare can have a positive financial impact on a hospital as well, which does lower the cost of care for patients. So that's all great. Thank you so much for sharing that. Kaylee, I want to turn to you now, looking at the operational side of things, and someone who works in sustainability in one of Michigan's largest healthcare systems. What do you see as the role of a clinician in collaborating with a sustainability professional like yourself and leaders and organizations to address climate change?
Yeah, there are really so many ways in which we can collaborate with clinicians around sustainability and climate smart healthcare. The first thing is really asking for their input and including not only clinicians, but all stakeholders, and creating awareness around our goals. So making sure everyone knows what we're all working towards. There are a couple goals I would like to highlight that we have going right now that I have clinician support on. So that's making my job easier. And it's just really great to just see that collaboration kind of take place naturally. So the first one is reducing waste anesthesia gas. This is a goal that we're working on. Waste anesthetic gases, which are unused gas exhaled by patients during a surgery or procedure. They are considered scope 1 greenhouse gases and make up 5% or more of a hospital's entire carbon footprint. So this is why we want to kind of focus our attention in this goal. So I created a work group around this goal to make made up of all of our stakeholders throughout the system. And the physicians have really led the charge on this one, which is really great to see. We are seeing many of our hospitals within Corewell Health start to eliminate one of the anesthesia gases with the highest global warming potential, called desflurane. I have also noticed that when one clinician kind of stands up and is vocal and says, yep, we are moving to remove desflurane from our hospital entirely, others follow suit. So when you get kind of one champion behind a cause, that quickly people kind of started to say, oh, okay, yeah, we will also do the same. So it was really kind of just exciting to see that take place. The other goal that is getting support from our physicians specifically, and therefore more traction, is our sustainable food goal. Physicians are asking that we kind of practice what we preach. So we had a group of physicians in our South region reach out and say, we need to focus on the food that we're offering our patients, our visitors, and our staff. They understand that what we feed them is a direct reflection of our values as an organization. So we kind of need to, like I said, practice what we preach there. So they want us to provide healthier, sustainable options that also taste great. And they are advocating for this for their patients, but also for themselves. We're all, if you're on site, you're likely eating in those cafeterias, but also we're feeding our patients and our population, and we want to make sure that they're healthy, sustainable options.
That's great, Kaylee. Really exciting work happening. I think you really highlight an important factor in the collaboration between clinicians and sustainability practitioners or administrators that are eager to do this work, and the value of having one person that is influential as a physician to speak up because they are seen within throughout our community as a trusted source. So I think that's really important. And for those that are on the call today, do not underestimate the power of your voice and advocacy within the institution that you are within, because you can make a great change by speaking up and asking the question. And oftentimes that's how this work gets started. So I'm going to stay with you, Kaylee, and talk a little bit more about greenhouse gas emissions outside of those scope 1 and 2 emissions, because it's estimated that within a hospital, up to 83% of total greenhouse gas emissions come from supply chain. So could you tell us a little bit more about greenhouse gas emissions and how they're embedded in supply chain and what options hospitals have to address the scope 3 emissions? And how does climate resiliency impact the value chain, playing a factor in the purchasing decisions as well?
Sure. So when thinking about supply chain and greenhouse gas emissions, we really need to think about the life cycle of all the products and services we source and include not only our direct suppliers, but also our tier 2 suppliers, which are their suppliers, and so on. Greenhouse gas emissions are really embedded in every aspect of a product, from raw material abstraction to production, transportation, use, disposal method, and really everything in between. So if you take, for an example, the greenhouse gas emissions for a patient linen, you will need to account for greenhouse gas emissions from cultivating the cotton crop for the fabric, transportation of that raw material once it's harvested, the energy and equipment needed to produce the linen, all the travel miles for any employee who's involved in that process, transporting the final product to the destination for use, the chemicals involved in washing that linen over time, and then when the time comes for that linen is no longer viable for use, transportation for end of life, or for that material to be recycled into something else. And that doesn't even catch everything. There's a lot that goes into greenhouse gas emission accounting. But that was kind of a brief overview of how greenhouse gas emissions are not only inconspicuous, but also insidious when we start to account for the true life cycle of a product from cradle to grave. So as for the options to address Scope 3 emissions, it's important to work with our suppliers to create awareness around our goals, as it's necessary to partner with them on their goals as well. So essentially our Scope 3 greenhouse gas emissions are their Scope 1 and 2 greenhouse gas emissions. So we don't have a direct way in which to affect those per se. We need to rely on awareness, education, encouragement, incentives, and then also our buying power. We have questions in our RFPs that go out to our suppliers around helping us move from reusable or to reusables when possible, encouraging our suppliers to create more efficient fleet routes that run on alternative fuel, moving to renewable energy sources when they can, avoiding chemicals of concern, and the list goes on and on. We want our suppliers to know that sustainability is a priority of ours. And as far as how resiliency impacts the value chain and purchasing decisions, resiliency is that space where we test our ability to adapt to change. So first and foremost, with increased greenhouse gas emissions comes climate change and more severe weather events that we talked about, more severe natural disasters that disrupt supply chains. They harm people, they affect healthcare delivery and access. They cause climate-related migration as well. We're actually fortunate to have a person on our team who is over supplier resiliency, and she is working on ways in which we can become more resilient, and I hope to partner with her a lot more in the future. But she's working on how we can become more resilient by deepening trade relationships to be more collaborative and less transactional with critical suppliers, using resiliency data, especially around our suppliers' level of preparedness and their sustainability programs to drive our product decisions. And as we gain visibility and grow in maturity in this space, it is our goal to layer resiliency and sustainability into the value chain. So we are indeed choosing to work with suppliers who have resiliency and sustainability plans built in. We do all this as a moral obligation to our patients and clinicians.
Great, thank you, Kaylee. And I think that highlights too the role that clinicians play in the purchasing decisions that are made or it makes me think about the role that clinicians play in the purchasing decisions of supply chain, and how clinicians can continue to advocate for solutions that reduce waste, reduce energy consumption, and are purchasing from businesses that are closer to home, which keeps our money in our local economies, keeping our local communities strong, as well as our supply chains close to us. So those are some of my thoughts that you asked, but in alignment with what you're sharing, that's what it sparks. So excited to see that continued progression for you. Dr. Del Bueno, what benefits do the IRA provide in terms of healthcare decarbonization? So let's talk about policy a little bit. What policies do you think could be instituted that would impact supply chain emissions? And how do you see the role of clinicians in advocating for these policies?
Sure. Thank you so much, Sarah. And I just want to say how impressed I am with the work that's going on in Corewell, and express my appreciation for your leadership. And I am excited to see that you already have this relationship developed between your clinicians and you guys leading the sustainability office, you as professionals in sustainability leading. So really excited about that. Now, the question was, what benefits does the IRA provide in terms of healthcare decarbonization? Well, the IRA, or Inflation Reduction Act, as probably everybody on the call knows, was passed in Congress last year as part of budget reconciliation. And literally it provides billions of dollars in terms of grants and loan programs and other investments, many of which can be applied to instituting climate smart healthcare, both in terms of decarbonization and resiliency. Now, the Department of Health and Human Services has developed a webinar series. It started in May, and it really gets into the weeds of utilizing the IRA to achieve a variety of goals. So we're going to put in the chat a link where you can see the full suite of upcoming webinars and recordings, as well as the fact that the next one is on June 8th, so just a couple days away, that looks at the IRA using that to maximize decarbonization. And finally, they have put together kind of a quick finder, if you will, that is a document that shows you how to leverage the IRA for the healthcare sector. Now, the other question was what policies could be instituted, what other policies could be instituted that would impact the supply chain emissions. And I think the most important policy by far to do this would be federal legislation that places an economy-wide, steadily increasing fee on fossil fuel producers, designed to go up and up and up until we transition away successfully from fossil fuels to a non-carbon, low-carbon economy. It would, if it starts low, it wouldn't shock the system, and then ideally it would go up predictably and transparently and create this market signal, which would incentivize suppliers to produce the same product in a less energy intensive way. The companies that produce, would be incentivized to produce quality products, and the ones with the smallest carbon footprint would make the most profits. And you can see then how that would make it much easier to decarbonize the healthcare system. So I think we as health professionals need to understand what a carbon fee legislation would look like. It's not very difficult to understand. It's critically important to getting at this 80% or 83% of greenhouse gases, which is embedded in the supply chain. Now, the last question was, what's the role of clinicians? We've touched on this a lot, and we're slow on time, so I'm not going to, we've used a lot of our time, so I don't want to go into too much detail here beyond clinicians are trusted messengers, especially nurses. And, a lot of clinicians are frightened to weigh in on policy because they see it as politics. But I would counter that. We as clinicians don't need to be partisan, which is what I think people are truly concerned about. In fact, we're really uniquely qualified to stay nonpartisan and bridge the divide and bridge the polarization that exists in this country, because health is not a partisan issue. It resonates across party lines, but we do need policies in place so that we can address these systemic issues like the climate crisis and the pandemic. And we as health professionals, we're the experts in this. So we need to be part of the efforts to influence policy, and ideally in a nonpartisan way. And I'll just close out by the fact that we have the good news story, has been touched on several times already, that by addressing climate change, we can save healthcare dollars. Gloom and doom shuts people down, but envisioning that brighter future that's ours to claim really activates people. And we as health professionals have that message to give. So thanks.
Great point. It's really hard to argue with advocacy for clean air and clean water and healthy and delicious food for folks that's grown close to home. So totally agree with that. We are getting close here now for question and answer, but I did want to offer Dr. Collins, if you wanted to add any final remarks regarding policy as it relates to climate resiliency and our ability to address inequities in our communities while also supporting and addressing climate change. I just wanted to offer some space if you have anything you'd like to add before we open it up to
Just a few things I'll add. First of all, I just want to ensure that really all entities are looking at their ESG model. If you have not started to look at that, you probably should. That's the environment, your social, your governance, and it's really the factors that allow you to create value. And as we look at the workforce, many more of those entering the workforce are looking at what you are not only doing for your patients, but what you're also doing for the environment. So look at that. Those are those intangible assets that we can't put a price tag on. Kaylee did a wonderful job at looking at the steps that hospitals can take, but I don't want anybody to remember those little things that we can also do. When we look at simply planting trees in areas where there are no trees, that makes a substantial difference in terms of absorbing some of those gases, in addition to changing the mood set and mindset of people that live in that environment. When we talk about advocacy, we very commonly don't talk about it, but should, redlining. So when we talk about redlining, that separates communities, that puts those communities that are already vulnerable at more marginalization in terms of housing. Those are the houses where there's still gas burning stoves. Those are houses that still have lead and asbestos. And so as hospitals and healthcare sectors are looking at housing as health, which many are, we have to look at the kind of houses that we're allowing our members and patients to live in. So yes, there's a lot that hospitals can do in terms of supply chain and transportation and food. But when we leave our walls, there are also other things that we can do and should be doing as a health system.
Very well said, Dr. Collins, and thank you all. I'm gonna hand it over to Rose to see if we have any questions from the audience.
Yes, thank you all so very much. All of your perspectives were incredibly insightful, and we really appreciate your time. We do have one question I think Dr. Collins wants to answer. What would be the name of the role that does manage supply chain, just so they know who to contact?
Yes, and different facilities have started looking at it a little differently, but usually it's a procurement officer. A lot of folks now have a chief procurement officer. Now that's also falling in some of the supply chain under the sustainability offices. So I would see, first of all, if there's a procurement officer, that's usually who does a lot of the supply chain. And if not, begin to look at a sustainability officer if that's in your institution.
Yes. And I would add supply chain, sourcing, procurement, purchasing, buyer are all different terms that can be used within a hospital for the people who make the purchasing decisions in conjunction with the clinicians. So those would be just to like add some of the different lingo because it's different based on what hospital you're in.
Can I add something real quickly to that, Sarah, please, or Rose? So what I really want to emphasize, Riley's going to put, I just put one link in there, but Riley is going to put links to additional information about how you can get involved if you're a health professional. And if you're wanting to know who to contact within your specific hospital, we have tried to put together documents that identifies people with emails, etc. So if you join MICA and if you reach out to Riley and you follow some of the steps that are being put in the link, you will get specific information to your hospital system, and we can help connect you with others who are interested in this. And the last shout out I want to give is that on September 12th, we are doing a even larger kickoff event, which will have nationally known experts involved, as well as opportunities for you to break out according to your hospital system, so you can work together and figure out, really tangible next steps.
Wonderful, thank you. We do have some questions coming in through the webinar chat. If anybody has any others, please feel free to submit them via the chat or the question and answer function in Zoom. We have a question. Let's see. Amy is familiar with Healthcare Without Harm and Healthcare Anchor Network, as well as MICA now. Are there any other associations or organizations that provide guidance or recommendations for healthcare systems in this space?
Yeah, I can take this one. Practice Green Health is a really great one. They have an abundance of resources. They are a nonprofit organization specifically for embedding sustainability in healthcare. So that is a really good one to look to. And they also partner with Healthcare Without Harm.
And we will have speakers on September 12th from Practice Green Health and Healthcare Without Harm, as well as speakers from HHS, Office of Climate Change and Health Equity, as well as potentially state speakers from the state.
Wonderful. And just somebody did ask in the chat whether or not the recording will be available after the webinar. Yes, it will be available after the webinar. We'll send it out via email to everyone who registered. And it'll also be available both on the Michigan Sustainable Business Forum YouTube channel and website. And then we'll have a link on it on Micah's website as well.
Rose, I did see a question too come through. Is the Michigan Hospital Association involved? And if so, how? I can kick off my historical perspective on this, and then if others want to weigh in. So the Michigan Health and Hospital Association does have a Michigan Green Healthcare Committee that I previously was involved in. I'm not sure, Kaylee, if you've been engaged with them. I don't think they've done a lot of work during the pandemic. But historically, the Michigan Green Healthcare Committee has been predominantly healthcare organizations in Michigan that are focused on specific sustainability goals. And so they have had some interest in sustainability and supporting it. They used to hold an annual conference. But I think maybe due to other priorities, it's kind of lost a little bit of momentum. So it'd be a great opportunity to get them involved moving forward. I think they understand the value of sustainability and addressing climate change. So yes, did you want to say something?
I think that's all really important, and we really hope that the Michigan Hospital Association, will work with us to lead this effort. And then I would also say that the American Hospital Association has partnered with the National Academy of Medicine and actually are part of a steering committee to lead these efforts nationally. And in addition, the state affiliates throughout the consortium, throughout the country have developed a sign-on letter requesting that the American Hospital Association and their state affiliates, so the Michigan Hospital Association, to actually take the climate pledge themselves and encourage others to do the same. We know that the American Hospital Association is supportive of these efforts and is on that steering committee. So we're very hopeful that they will actually formally take the pledge. It may just not have occurred to them. But the last thing I would say is, in my personal work that I've done with my hospital system, that was one of the first questions that they had. What does the Michigan Hospital Association say? What does the American Hospital Association say? So I think Kaylee, you probably, and Sarah probably know much better. They look to the Michigan Hospital Association and the federal American one for their leadership in this specifically.
Wonderful, thank you. Where are the pressures for climate sensitivity coming from in healthcare? Is it patients, regulators, administrators, a combination of them?
I'll start, and I think everybody probably has an opinion here. I would say advocates. I think as there is more information coming out every day in terms of the damage that climate change is doing to our environment, so there's an environmental component there. As we look at new jobs that are being developed as a result of creating sustainability, the labor unions have started to get involved because JCAHO is going to really soon probably mandate that hospitals are getting involved with climate change and resilience and mitigation and adaptation. Some hospitals have now gotten involved. As I talked about ESG, for those that have been involved with it for a while, they've always understood that component of environment and sustainability. And so I would say it's not, I don't think it's so much pressure. I think as we get more knowledge and see the different tentacles, I would say, that climate change has in terms of the effects and benefits and changes that you can make, everybody's starting to get involved. There is really a component for everybody. And someone else asked the question around researchers. It depends on what your research is. We need a lot more research on health effects. We need a lot more research on environmental effects of what's going on in the environment. We need additional research on mitigation strategies and the benefit of those strategies. We need a lot more research on tool development. You know, what other ways can we hone in on what the air looks like or what our water looks like? If you live near water, as I do, I want somebody to figure out how to decrease that sea level rise so that my house is not gone. So there's a ton of research, but I think it depends on what your interest is or what your area is. I thought I'd just add that on because I saw that.
The only thing I would add to that is that I think, you know, talking from the clinician's point of view, you know, Dr. Collins is really unusual in her ability to synthesize the variety of systemic pressures that, you know, are impacting her day-to-day practice. I think a lot of us are so busy just trying to get through the day, at least for the majority of the time that I practiced, I was not connecting dots. So I think when we think about educating, especially our peers, one of the big issues is connecting the dots for people. And the clinical story is really helpful with that. If you can recount some anecdotal clinical stories that helps connect those dots, suddenly people have these aha moments. The last thing I would say is, you know, a lot of hospital systems have really suffered the impact of climate change. You know, out west, they've had to evacuate, you know, some of the Santa Rosa hospitals, not just once, but twice because of wildfires. You know, Katrina was certainly an impact. When Hurricane Maria hit Puerto Rico, talk about supply chain. Our, you know, IV solutions were not available or not readily available, greatly limited across the whole US because almost all of it is made in Puerto Rico. So, you know, we are being impacted right now, but I think in our busy lives, we have a hard time, you know, noticing it. So that's our role, is to try to connect those dots and make people more aware of why it's so important that we get on this.
Wonderful.
And I would just add as well, you know, healthcare system signing public pledges and putting that out there is a way to hold us all accountable. And it gets leadership involved. They have to approve that these goals that we're signing on to, and then they start to direct resources to actually help us get us there. So I think that's a huge push.
And to follow on that, Kaylee, one of the things that as health professionals, even if your hospital system has taken the pledge, there are only two in Michigan that have, and that's Henry Ford and Ascension. Your job is not done, because then you have to hold the administration accountable, make sure that the funds are directed towards, you know, departments like Kaylee runs and is part of, to actually carry out and implement and achieve those commitments. So we can continue to work in a partnership to form that green team to make sure it happens.
Wonderful. Thank you. And we are at time today. Thank you so much to all of our panelists for sharing your amazing experiences and all of your knowledge. If anyone has any follow-up questions, we'd be happy to connect you with our speakers. We'll be following up with an email with a recording of the presentations. And if you have any additional questions, you can reply to that. So thank you everyone for attending. If you found our talk valuable today, please do consider becoming a member of both MICA and MISBF, which you can check out both of our websites for that information, and then also attend some of our upcoming webinars as well, which are also on our website. Thank you so much, everybody, and I hope you all have a wonderful rest of your week.
Thank you.
Have a great day.
Thanks so much. And thank you, Yvonne and Rose. And I think it went well.
I think it went fantastically.
Thank you for the invitation, Lisa.
Sure.
Thank you, Rose.
Thank you. It was great to meet you, and I look forward to working with you more.
Absolutely. You guys have a great day.
You too.
Bye-bye.
Bye-bye, everybody.